Good morning, students. Today I will be presenting about a topic on research utilization. The topic is how to make use of research findings. So, the outline of my presentation will be I'll be talking about research process, research utilization, history, types, model of EBP, barriers of research utilization, and strategies of research utilization. As all of you know, the phases of research process, it consists of mainly five steps. Research process consists of mainly five steps: the conceptual phase, design phase, empirical phase, analytical phase, and finally the dissemination phase. In the first phase, conceptual phase, you decide upon the type of research problem, and you will review the literature related to the study. And in the design and planning phase, you will design and plan the research study. In the empirical phase, you will collect data and prepare data for data analysis. And in the analytical phase, you will analyze your data and interpret the results. At the end of the analytical phase, you will get the research findings. You have the research findings with you. And final phase of the research process is the dissemination phase, which includes communicating the research findings and utilizing the research findings. See, the dissemination phase is not complete unless the research findings are utilized in practice. If, for example, if you give a 9-digit mobile number to a person instead of a 10-digit mobile number, it is of no use. Similarly, the dissemination phase is incomplete if the research results are not utilized. Now, there is always a gap between the research and the practice. So here the research translation is sometimes known as research utilization or research exchange or research uptake. The research utilization is sometimes is a type of research translation in which we are bridging the gap between the knowledge gained through research and its application in policy and practice. The main research utilization projects were undertaken to let us see the history before going into the details of the research projects. See, you know that nursing research has changed dramatically in the past 150 years, beginning with Florence Nightingale in the 15th century. In the 19th century, the culture of nursing research has now advanced to the point where consideration can be given not only to the conduct of research but also to its application in practice. During 1980s, the research utilization concept has emerged to improve the use of knowledge in practice. The use of knowledge in practice. In 1990s, evidence practice movement took over, where a clinician can no longer rely on the memorized information, but he has to develop skills in accessing, evaluating, synthesizing and using new research evidence. So, research utilization is the process of conveying and applying research based knowledge to impact or change existing practices in the healthcare system. It is a multiple step process which involves first you have to determine the research knowledge ready for use in practice. Then you have to persuade the nurses to use this knowledge in practice, and finally to make a decision to use the knowledge in practice, and finally implementing this knowledge to change the practice and determine, and at last you have to determine the outcome by making the research based change in practice. There are three types of research utilization. First one is the indirect research utilization. This is otherwise known as conceptual utilization, which involves changes in nurses' thinking. The second one is the direct research utilization, that is otherwise known as instrumental utilization, that involves direct use of findings in giving patient care. The third one is persuasive Persuasive means involving the use of findings to persuade others. Others means those who are in decision making process, the policy makers, to make changes in policies, practices which are relevant to nursing care. So these are the three types of research utilization. Now, on what criteria you will utilize the research findings? The research findings should be accurate, it should be reliable, it should be generalizable, and it should be clinically relevant, and we should be able to make it implement. Cost benefit ratio is also important. The feasibility and transferability of the findings into practice level is to be considered. So, research utilization was not a problem unique to nursing. Many disciplines have actually experienced difficulties in promoting change based on research. Here the Rogers studied a process of using research findings in society, and he developed a theory for communicating innovations or ideas through research. And it is a 5-step process, 5-stage process. The first stage is knowledge, and second stage is persuasion, third stage is decision, fourth stage is implementation, and then confirmation. This knowledge is the first awareness of the existence of an innovation or a new idea for use in practice. You have an idea, you have an awareness of existence of an innovation, and that is usually based on your previous knowledge or characteristics of the decision making unit can influence the knowledge. And the second step, during the persuasion stage, nurses form an attitude that is favorable or unfavorable towards the decisions, then a decision is made to adopt or reject the innovation. In the implementation stage, involves either adopting or not adopting the change. During the confirmation stage, nurses seek reinforcement in these decisions. Either they will continue to adopt or they reject the change in the practice. So this is the Rogers theory of diffusions, which is widely used for utilization of research. So these were the research utilization projects which were there in 1970s and 80s. First one is Western Interstate Commission for Higher Education, which was developed in mid-1970s by Kruger and colleagues, which was developed to increase nursing research activities within the western region of United States. And there was another project called the Kern Project, or Conduct and Utilization of Research in Nursing, which was developed by Horsley. This project was mainly focused on the development of research-based protocols and implementing the protocols and evaluating a change in the practice. So the Kern project activities were mainly involved identification and synthesis of multiple studies in about a common conceptual area, and they try to transform this knowledge derived from the research base into a solution of research based clinical protocol, then transformation of the clinical protocol into specific nursing actions or innovations that are administered to patients, then clinical evaluation of the new practice to ascertain whether it produced the predicted result or not. Now the evidence based nursing. The term research utilization and evidence-based practice are sometimes used synonymously. Although there is an overlap between these two concepts, these two things are entirely different. They are distinct one. In research utilization, the emphasis is on translating the new knowledge into real-world application. But EBP is a broader concept than research utilization. We can see EBP in detail. Evidence-based practice integrates the clinical expertise, and the latest and the best available research evidence is utilized, as well as patients' unique values and circumstances are considered while implementing evidence-based practice. Evidence-based nursing is an approach to making quality decisions and providing nursing care based upon personal clinical expertise in combination with the most current relevant research available on the topic. So what do you mean by this research evidence? How do you get this research evidence? Research evidence is nothing but it's a synthesis of research findings. This is done to determine the evidence for practice. This synthesis of quality relevant studies is formed to form a body of empirical knowledge by a process called cognitive clustering. Cognitive clustering is done through integrative reviews of literature, systematic reviews, meta-analysis, meta-summaries, and meta-synthesis of the research literature. So these are the various methods of nursing research reviews. First one is integrative reviews. Integrative reviews means it's a summary of the literature on a specific concept or content. It could be a quantitative or a qualitative study. It is a narrative in nature. Then comes systematic review. Systematic review is a summary of past research studies with related identical hypothesis. Then comes meta-analysis. Meta-analysis is a summary of many studies using statistical techniques to estimate mainly the effect of an intervention or relationships. Then comes summary or meta synthesis. This is for the past research findings, combining the qualitative research. Qualitative, mainly the qualitative, multiple qualitative studies, findings from multiple qualitative studies. So now comes the critiquing. Critiquing research, how critiquing and evidence are related. Critiquing research is an essential steps towards your practice on empirical evidence. An intellectual research critique is a careful, complete examination of a study to judge its strengths, weakness, logical links, meaning and significance. That leads to a high quality study. You can identify a high quality study by an intellectual research critiquing process. A high quality study means if it is focused on a significant problem, it ultimately uses sound methodology, credible findings, and it provides a basis for additional studies. So ultimately, you develop the research evidence. Findings from several studies can be critiqued, and as it is synthesized to provide a empirical evidence. Okay. So, and there are why EBP is important. The slide is very simple and explanatory. It improves the delivery of healthcare. It strengthens the outcomes. It diminishes geographical differences in care and cuts cost. Decreases healthcare cost. It builds their body of knowledge. It minimizes the gap between nursing, education, research, and practice. It standardizes the nursing practices. So next is the levels of evidence. There is a evidence hierarchy based on the strength of the research evidence. The strongest evidence is generated from high quality meta-analysis or systematic review, that is at the top of the pyramid. And as down the pyramid, you will find well conducted, well designed, controlled clinical trials with consistent and statistically significant results. And down you can see various types of studies. At the base of the level of evidence, you will find the editorials. If there are no studies related to a particular topic, you can even refer to an editorial or an expert opinion for research utilization. Now this slide shows the steps in EBP. It's very simple. There are many models which are related to EBP. Stetler's model, Iowa model, Roberts model. I am not going into the details of such models. Basically, all these models reveals how an EBP procedure is done, how evidence-based practice is done. First step is ask a question. Next is search the literature. Third step is critically appraise the literature. 4. Synthesize your findings, implement those things, and finally evaluate. These are the simple steps in evidence-based practice, in any of the evidence-based practice model. Now we are coming to the directly to the topic how we utilize these research findings. You can utilize these research findings in multiple areas like education, practice, research, and administration. In clinical areas, nurse administrators can utilize research findings in clinical decision making, directing patient care for quality improvement purposes. They can update their policies. They can develop research based protocols for nursing interventions. And second one is application in nursing education, evidence based teaching. You can question educational practices, identify the need for evidence to guide teaching, searching for research studies on educational practices, evaluate the quality of evidence, decide whether the findings are applicable to one's own program. The main thing what a nurse administrator can do is create a culture of nursing research that plays a very important role in influencing the behavior and performance of nurses. Helps in research, information and learning, flexibility and adaptability, collaboration and communication among employees. They influence staff, nurse research participation, leadership strategies, training and professional development. Then affecting hospitals to adapt to changes. This is the role of an employee to do that helps in the organizational performance and success, and also improves employee engagement and job satisfaction. And also in research you can improve future studies. You can identify gaps and limitations in the studies, compare and contrast research findings with other studies, apply and generalize to different contexts, communicate and disseminate effectively, reflect and learn from the process, replicate studies as needed, update and revise as needed. So these are the various barriers to research utilization. There are research related barriers, clinician related barriers and administration related barriers. Research related barriers means insufficient current research with solution to complex clinical problems. Some researches are not replicated. Some researches are not published. Example, dissertation, thesis. Clinician related, there is attitude towards nursing research. Practitioners are not accustomed to read journal articles, dependence on tradition. Then administration related factors are there. So there are many strategies to facilitate research utilization. For nurse education, they can use research findings to support lectures and teachings, motivate students to conduct research activity. For nurse researchers, they focus on research activity on current clinical problems, disseminate the research results as early as possible, present research findings locally, regionally and nationally. So basically you can conduct journal clubs, conferences, support research in your settings. Educators can role model utilization of research in their teaching and engage students in reflective practice. So there is a recent study which shows that a systematic review which revealed barriers to research utilization. One of the most important factor identified was setting related factors, and the second one was presentation related factors, and third one was nurse related factors. The study also revealed that insufficient time at work was problem in implementing new ideas. So to conclude, research utilization is the ultimate outcome of the research process. A research process cannot be considered complete until the findings are applied in practice. Research utilization helps researchers to bridge the gap between knowledge, practice and research. An effective research utilization leads to an overall improvement in research, knowledge and practice among healthcare providers. So read the literature. Intellectual research critiquing is important. Synthesize your research findings, generate evidence for use in practice. So the way to get started is to quit talking. There is always a gap which is existing between the research side and the practice side. So the way to get started is to quit talking and begin doing.